Alright, welcome to this video. In this video, we'll complete the section on peptic ulcer disease, pharmacology of peptic ulcer disease. We'll complete it in this video. Now, the first drug we want to talk about, in the previous video, we've talked about the PPIs, we've talked about the H2 blocker, we've talked about antacid. Now, in this video, we will talk about other agents we use. So, the first other agent we want to talk about is misoprostol. Misoprostol, okay. This one is a E1 analog, prostaglandin E1 analog. Okay, misoprostol is a what? Prostaglandin E1 analog. So what is the mechanism of action? Misoprostol, what it does is that it increases blood flow to the mucosa. It increases blood flow to the mucosa. And you know, if you can increase blood flow to the mucosa, you are going to increase mucosal secretion. You are going to increase bicarbonate secretion also, because the more blood that is getting to the mucosa, the more the mucosal secretion, that is the more mucus that will be secreted, and the more bicarbonate that will be secreted. You are getting it now. So that is the mechanism of action of misoprostol. So what is it used? Misoprostol is the specific drug for NSAID induced ulcer. So for NSAID induced ulcer, NSAID induced what? Induced ulcer. Misoprostol is the specific drug. I didn't say it's the drug of choice. The drug of choice still remains PPI. Remember we said in the first video, we said that PPI is the drug of choice for all ulcer except stress-induced ulcer. Okay, except stress-induced ulcer. PPI is the drug of choice for what? For all other ulcer except for stress-induced ulcer. For stress-induced ulcer, the drug we use is H2 blocker. Okay, for stress-induced ulcer, the drug we use is what? H2 blocker. I think I didn't mention it in the video I did on H2 blocker. I mention it now here. That is drug of choice we use for stress-induced ulcer is what? H2 blocker. Are you getting it now? So, but for this one, NSAID induced ulcer, we use misoprostol. It is the specific drug to use. Are you getting it now? Okay, but it's not the drug of choice. The drug of choice is PPI. Now, let's now come to the side effects. What are the side effects of giving misoprostol? So just imagine that a drug is increasing blood flow to the mucosa. It's going to increase the activity of the gastric, of the GIT. And if the activity of the GIT increases, it can lead to diarrhea. So that is why the most common side effect is what? Diarrhea. Then, as a rule of thumb, it can also cause what? Nausea and vomiting. Okay, can cause what? Nausea and vomiting. Then, it can cause what we call it is an abortifant, meaning that it can cause abortion. It can cause what? Abortion. So it can cause abortion. If given in pregnancy, it can cause abortion. Then number 4 is that it is teratogenic. It is what? Teratogenic. When we say teratogenic, if a pregnant woman take this drug and it doesn't cause abortion, it can make the fetus to be deformed. Okay, so it is teratogenic. It can lead to what we call facial nerve palsy. So cranial nerve 7 and cranial nerve 8 can be damaged. And when these two nerves are damaged due to misoprostol, we call it Mobius syndrome. We call it what? Mobius syndrome. Mobius syndrome. When cranial nerve 7 and cranial nerve 8 is damaged due to this misoprostol damaging them as a teratogenic agent, okay, can cause this damage, Mobius syndrome. Are you getting it now? Okay, so that is for misoprostol. Then, apart from that, let's now go to another agent. This is everything about misoprostol. Remember, it is a specific drug for NSAID-induced ulcer, but not the drug of choice. Are you getting it? Okay, so the next agent we will talk about will be agents that are protective agents that just line the stomach. Okay, so we have ulcer protective agents. That's what we'll talk about now. Ulcer protective what? Agents. Now, this ulcer protective agent, there are two of them. We have sucralfate, and we also have what? Bismuth. So I will take both of them simultaneously. So let's start with sucralfate. Now, this agent, what they do is that they line the mucosa. They just cover the ulcer. That's what they do. They what? Cover the ulcer. We call them ulcer protective agent. So they act like, let me use the word Smith. They will just go there, cover the ulcer, so that cover the mucosa, so that if that particular place will not be irritated by the acid. So that's what they do. So for sucralfate, now one thing about sucralfate is that sucralfate require an acidic pH in order to function. What does that tell you? It requires what? An acidic pH in order to polymerize and coat that stomach lining. So if, for example, this is your stomach lining, are you getting that? This is your stomach lining. Then we have an ulcer here, for example. When sucralfate want to work, it will need to polymerize and cover this place. Are you seeing it now? It will need to work, polymerize and cover that particular ulcer. But it needs an acidic pH. It means that you cannot combine sucralfate with other drug we use for peptic ulcer. You know the other drug they're trying to decrease the, they're trying to like increase the pH rather. They're trying to like take away the acidity. You are getting it now. So and sucralfate now require acidity in order to work, in order to function. So we cannot combine sucralfate with other anti-ulcer agent. So that is the major limitation of giving what? Sucralfate. Are you getting that? That is the major limitation of giving sucralfate. Okay. So in terms of this side effect, the side effect, it can cause what we call hypophosphatemia. Phosphatemia. Okay. But the main thing I want you to remember about sucralfate is that you can't combine it with other drug. Yes, it's effective, but we can't combine it with other drug. And now, since we have other effective drug, we don't too use it like that again. But again, for theory's sake, know that it is a what? An ulcer protective agent. In fact, it is a sucrose sulfate salt of aluminum. I get my point. It's an aluminum salt of sucrose sulfate. It is an aluminum salt of what? Sucrose sulfate. That's why it is called sucralfate. Are you getting it now? Okay. So that is for that. Now come to bismuth. Again, bismuth is also a ulcer protective agent. They also cause that lining. They protect the ulcer. Are you getting it? They are called what? Ulcer protective agent. Now there are two types of bismuth. There are two types of bismuth. Take note of this. There are two types of bismuth. We have bismuth subsalicylate and bismuth subcitrate. Okay, bismuth subsalicylate and bismuth subcitrate. Now I will explain the two of them and tell you where they are used and their implication. Bismuth subsalicylate is the one that is majorly used for traveler's diarrhea. That's one of the indications. In fact, it's the drug of choice for traveler's diarrhea and even for prophylaxis of traveler's diarrhea. People who travel, they usually carry it along. So bismuth subsalicylate. Then for bismuth subcitrate, this bismuth subcitrate specifically can cause detachment of H. pylori. You know, H. pylori is the microorganism implicated in peptic ulcer. You are getting it now. H. pylori, Helicobacter pylori. It is the microorganism implicated in what? In peptic ulcer. So when you give bismuth subcitrate, it can cause detachment of that organism. That's why this bismuth is part of the quadruple therapy in the management of peptic ulcer. We'll see it later on. There's what we call quadruple therapy, there's what we call triple therapy. Are you getting it now? So what is the mechanism of action of bismuth? Again, it causes as a protective agent, can cover the lining. You're getting it now. It also increases prostaglandin secretion. And you know, if you increase prostaglandin secretion, that will lead to what? More blood flow to the stomach. You know, prostaglandin are protective in terms of ulcer, in terms of the stomach. So it will lead to more blood flow to the stomach, more mucus secretion, more bicarbonate secretion, and the rest. But again, it also acts as a what? As a ulcer protective agent. Are you getting it now? So those are the ways bismuth acts. Specifically also, remember that bismuth subsalicylate can cause detachment of H. pylori, while bismuth subcitrate can be used as an agent for traveler's diarrhea. That is one of the drug of choice where it is used also. So that is for that. Now we will now come to the therapy, the combination therapy for the management of peptic ulcer. So this is the last part of this lecture. So combination therapy for the management of peptic ulcer. That's what we want to talk about now. So the combination therapy. So therapy. So for the therapy, we have the triple therapy, and quadruple therapy. Okay, this one is 3, while this one is what? 4. You are getting it now. Okay, so this one, you can remember the drug in this place. I believe you know cyclic AMP from biochemistry. So you can remember them with what? Cyclic AMP. So cyclic AMP, okay, where C is for clarithromycin, I will just mention them. A is what? Amoxicillin. M is what? Metronidazole, and P is what? A proton pump inhibitor. So this is for the triple therapy. So you will ask me now, there are more than 3 drugs here. So it means that you can either give amoxicillin or metronidazole. Okay, in this triple therapy, either you give amoxicillin or metronidazole. So clarithromycin, amoxicillin, PPI, or clarithromycin, metronidazole, PPI. That is for the triple therapy. But for the quadruple therapy, the mnemonic we use is TOMB therapy. TOMB. T for tetracycline, O for omeprazole, which is a proton pump inhibitor, M for metronidazole, and B for what? Bismuth. And I believe you know this bismuth. This bismuth is what? Bismuth subcitrate. Okay, bismuth subcitrate. That's what we use. Okay, so this omeprazole, you can use other PPI. Omeprazole just stands for the PPI to make this TOM pneumonia come alive. Okay, so this is the triple therapy. This is the quadruple therapy. So this is everything about peptic ulcer. I believe you've learned a lot. We've talked about the PPIs. We've talked about the H2 blockers. We've talked about antacid. We've talked about misoprostol. We've talked about ulcer protective agents. Okay, so ulcer protective agent, that we'll talk about sucralfate, we'll talk about bismuth, and now we'll talk about the drug, the therapy. Each of them, you give them for 14 days, that is 2 weeks. Both this quadruple therapy and both this triple therapy and the quadruple therapy, they are given for what? 14 days interval. 14 days interval. All right, so I believe with this series of lecture, you can now say, oh, you have an understanding in the management of what? Peptic ulcer. All right, see you in the next one. Thank you very much. Do it to like, do it to subscribe. Thank you.